One of the most common changes after breastfeeding and childbirth is that the breasts were big and full with milk, and then after they went down, the breast became saggy and loose. And it's one of the most common questions we get asked as plastic surgeons is, can that be fixed? And the answer is yes. And it can be fixed through what's called a breast lift, also known as a Mastopexy. And that's what we're going to talk about today. I'm Dr. Matthew J. Nykiel, board certified plastic surgeon in sunny Southern California with offices in Newport Beach and Upland, California. And let's dive in, or lift up, into the breast lift. From a goal standpoint, the goals of the breast lift are really twofold. Number one, we want to move the areola and nipple back up into the center of the chest. By doing that, we will actually take away the sag that has developed. And finally, as a sort of a soft goal number three is, whenever we lift the areola up, we always decrease the size and shape of that areola. Typically after breastfeeding, it becomes enlarged, or it's not so much circular anymore, and we try to restore that circle shape. Trends of breast lifts have changed over time. In the beginning, we used to do breast lifts only, and that is absolutely an option, and some people want to only do a breast lift. However, what most people are looking for is a more youthful shaped breast, and typically with youth, we have more volume or cleavage to the breast. So we frequently combine an implant with the lift, which also known as a Mastopexy augmentation or breast lift and implant. Now, with the advent of a new product called Alloclae, which is essentially other people's fat, we're able to create volume to a breast without the implant. So we are now able to do a breast lift, let that settle and relax, and then come through and inject more fat into the breast itself to help get volume. We can also always use your own fat to the breast to get volume. We have three main techniques or ways to achieve the breast lift. And those three ways are based on how big the scar is. In the first technique, we're talking about people that have very little to almost no sag at all. And essentially they've just got a little bit of, their skin is as tight as they want it to be. And we can make what's called a donut, or just make an incision around the areola to help tighten that up. Again, it's for very minimal amounts of sag or very minimal amounts of loose skin. In the second option, we make a incision that goes around the areola again, but we make a vertical line down the middle. This is used for people that have a little bit of sag, but not a ton. Maybe just a little drop in the areola nipple, but again, not pointing straight down. This is not the majority of people. It's actually a small minority of people. For most people, we use what we call type 3, which is that upside down T or anchor shaped scar. What that scar position does is it allows us to take the areola, move it back up into the middle of the breast, and also effectively help to shape the breast, getting rid of that sag and creating a rounder shape to the breast. Now, there's some important things I want you to understand that a breast lift does not do. A breast lift does not increase volume to the breast. A breast lift does not give cleavage to the breast. Those things are done through volume, and that's done by one of three ways: implants, your own fat, or now someone else's fat through Alloclae. Recovery-wise is typically about 1 week. The procedure is done under general anesthesia, which means you're asleep. We have anesthesia providers, a full OR staff team there, monitoring you, taking care of you. The procedure takes me roughly about 2 to 2.5 hours to perform. Kind of depends on how much sag there is. And you get back to exercising after 6 weeks. A very important thing you need to understand about a breast lift is there is a timeline to healing before it looks normal. In general, your skin is going to relax and soften after surgery. We know this as surgeons, and we need to almost play this in advance or over tighten the breast so that it looks good 3 months, 6 months, 1 year down the road. And the way we do that is we actually tighten the breast very much on the bottom, which keeps the breast up on top. It almost kind of looks like an upside down breast. It can look a little square. And in general, most people feel it doesn't look that good. It takes about 6 weeks for this volume to fall down, and it takes about 3 months for the breast to round itself out. So with a breast lift, you really need to give it 3 months to evaluate that sort of final result that you get. This is very specific to the breast lift itself. From a pain standpoint, breast lifts are pretty well tolerated. Now, breast lifts are typically a part of a mommy makeover, and that can change the recovery and healing timeline based on specifically what else we're doing in combo with that mommy makeover, but that's something that can be gone over in consultation. If you want to learn more about a breast lift or to understand, would you like to add on those volume augmentations through implants, your own fat, or Alloclae, come in for a consult. Maybe you're just sort of going around wanting to learn a little bit, we have a huge educational video. Like, follow, subscribe. We have topics about Alloclae itself. We have talked about fat transfers of breasts. And we have topics about implants and breast lifts. So learn more. And when you're ready, reach out. I'm Dr. Nykiel. Talk to you later.